Okay, so if we look at the exam format, I think most of us are aware by now about this exam format. If you have any doubt regarding this exam format, we can discuss. So quickly, I will revise this exam format for you. So the exam is, you are going to go through this exam in 20 minutes stations. There are going to be a total of 8 stations. And so altogether, it's going to be 2 hour and 40 minutes of talking in the exam. You're going to talk for 2 hours and 40 minutes without any break while you're talking. Otherwise, there are 5 minutes break in between the stations, and between the first half of the exam and the second half of the exam, you are going to have a 20-minute tea break. So we already discussed that the stations are clubbed into subjects. So every station are going to have 2 subjects. We know that Euro-Onco 1 is going to be clubbed with RCC and bladder are clubbed together. Sometimes, very rarely, they ask about upper tract carcinoma as well. Euro-Onco 2, they club the prostate cancer, the penile cancer and the testicular cancer. If you are, so most of us prefer to get prostate cancer in the exam, but if you are if you have a your luck might be like you might get a penile cancer and a testicular cancer as a combo. So the next is going to be a pediatric urology station, and then the emergency. So there are going to be 2 scenarios from pediatric, 2 scenario from emergency. They can be anything. They can ask about an andrological emergency or an infection emergency, or anything related to acute colicky pain due to stone. So any scenario which is not might not have prepared as an emergency, they might give you an emergency scenario. So you should be ready for everything, and that will come only if you practice. They can give you a scenario: you have operated a radical cystectomy and the patient has now uh, burst abdomen. So they can give you any scenario, so you should be able to manage all this. You should know how to approach, how to begin at least saying, because the first few words that you utter in the exam really matters. So this sequence, which I have mentioned here, this is exactly the sequence that a candidate is going to face. So it's not that after Euro-Onco 1, you're going to get a stone and infection station. So you will go through this sequence of stations. So somebody might be starting from emergency. So if somebody is starting from emergency, then the next station is going to be stones and infections, and then female and functional urology. So this is the sequence that the Royal College is following. So I have discussed about certain tips that when you go for the exam, you should be very calm and composed and try to walk in the exam like a consultant. This is very important that you shake hands with the examiner and you greet any observer who is sitting nearby, who might be just observing the examiners, or they might be observing you. The observer usually has no role in marking you, but it gives a very good impression to the examiner if you are addressing everyone over there on the table. So always try to give a very short and very relevant answer to the topic, because if you're talking about something very different from the question, then the examiner might get very annoyed with the answers, and that will reduce your marks that you have scored earlier. So believe me, you might have all the knowledge for the exam, but maybe you are not able to present it well. So this is very important, that when you complete your exam, you should feel like a consultant is discussing with another consultant. And that's it. This is all about the Viva exam. So we have discussed about this marking scheme. Regarding the marking scheme, we should know that these are the 3 components. The Royal College mentions the 4 parameters on which a candidate is marked. So the last parameter is no more considered a marking scheme, because it's a bedside parameter, not assessed. So they assess your overall professional capability, your knowledge, and how you present your knowledge. That is your quality of response. And it's very important that your quality of response is really very important, because suppose your target is going to be 7, to score 7 in each of these 3 parameters of judgment. So suppose if you look at the quality of response, the if the
ठीक है
quality of response, there is one important point that we have to keep in mind is amount of prompting the examiner has to do. So if you think that, okay, you have said, okay, I will resect the bladder tumor and then I will follow up the patient. So the examiner will prompt you, do you want to do anything else after you have resected the bladder tumor? And then, okay, you say, okay, now, okay, yeah, I forgot, I will instill the mitomycin C also intravesically. So this prompting will reduce your marks because you have to say on your own, okay, I'll resect the bladder tumor followed by an intravesical mitomycin C. And so that the examiner can lead you to the next question, okay, what is the role of mitomycin C and why do we really need a mitomycin C? And then, so this is very important. Again, the relevant literature quoting. The whole scene is many of us don't know when to quote what literature. We have a lot of references. We have gone through many important articles. When we sit for the theory exam also, I know some of the candidates who have registered are appearing for the section 1, and definitely for section 1 also you should be thorough with the literature. It's very important. They will ask you about the literature as well. So suppose they ask you the literature, the reference for mitomycin C, and you give a very vague answer, then the examiner will be disappointed. When you don't know an answer, it's better that you don't give a irrelevant answer, because you are a consultant and you are not you. It's all right if you don't remember a reference at that point. You can just say, okay, sorry, sir, I don't remember it right now. That will be a more honest answer expected by a consultant than saying, okay, something relevant just to keep talking. So believe me, we are going to focus on each of these marking parameters during our course. This is very important that preparation has to be exam directed. We should not, we should keep this exam marking format in mind. And regarding the pass marks, it's very important that every candidate should score 72 in every station. So 20 minutes of talking should fetch you 72 marks. And the maximum mark is 96. So during the 20 minutes of talking, you are discussing two different subjects. So for a subject 1, you have to score at least 36 marks from both the examiners. So each examiner is going to give you, so if you go back to this, minimum marks is 6 in every parameter. So every examiner has to at least give you 18 marks for you to pass. So the two examiners have to give you 36 marks in every subject for you to pass. So if you are appearing for the one station, there has to be 36 marks in one subject and 36 in the other. So you should score at least 72. But the target should be more than 80. Believe me, if you have not done well, which is very, very possible that you might not score well in one subject, and maybe your infections did not go well, maybe your functional urology was not good, you did not face a very good urodynamics and you were not very confident with that. Even in the section 1, believe me, urodynamics tracings are going to be put up. We're going to discuss those urodynamic tracings, and so all those things are going to be in the section 2 also. They will hand you that, and you will have very small time to interpret and understand and produce your inference from that. So the total pass marks for the exam becomes 576. And so when you are done with the exam, just relax and stay calm, because the results are going to come very, very soon. So in between the breaks, I forgot to mention. So when you get a break in the exam, so don't discuss the topics with your colleagues. It's not going to help. There are going to be a lot of different scenarios the examiner has. They have a lot of different printouts. They are going to have different set of imagings, and they are going to shuffle it between the candidates. So you very rarely two candidates are going to get same scenario on the same day of exam. Even on the different days of exam, they are going to change the scenario. So no need to be worried about it, what my friend has got. So just try to believe in your preparation, because that is all that is going to you're going to carry with the in the exam. So once you're done with the exams, just roam about the place, explore the place, because by the time you come back home, you will find your result is there. And I've
खा ली एंड्रो कहने खा ली
okay, I'll add a few more members. Okay, so yes, you're going to get this result very soon in your And if you are really, really, really hardworking, as I've said, that this gold medal is all about your. It's all about, it's for you to get motivated, and probably, definitely, any one of you can get this if you start early, and if you just dedicate and practice a lot, and don't hesitate in sharing your queries. You will definitely have your doubts. The guidelines are, there are some controversial points in guidelines which we might be scared in addressing, and but we there will be controversial topics the examiner might be asking you. For example, the examiner will take you to a discussion on hormonal therapy in undescended testes. So that's a very controversial discussion, but the examiner wants you to see how well you can come out of this controversy with a very good conclusion. Like, you have some knowledge that, okay, this can be used in a adolescent or a pre-pubertal age group, so you should know about something about that and how to come out of that trap. So give irrelevant answers. See, this is a controversial discussion. There are some literatures which say that, okay, this is this finding. So that will give the examiner a very good impression, and that's how the journey goes to the level of the gold medal. So regarding the course, we have already discussed, and we have some registered candidates, I think, here with us today also. So we are planning for the 2 month course, and it is going to be, so we are planning for 16 sessions. What we are planning is twice weekly we are going to have the sessions, and we are planning for every session to be of 2 hours duration. We are going to interact with each other. The whole exam is about interaction and talking and conversation and communication, so we should be interacting more and more, and we should try to, I will make schedules so that towards the end of the discussions, I will make sure that one of you become a candidate and one of you become an examiner. Because when you become an examiner, you get to learn something which you might not have learned as an exam as a candidate. So it's important for you to play both the role. And so believe me, we will be connected till we pass the FRCS exam. And so this was the plan of the course which we have already tested. So we are planning to have volunteers in every session, and we are going to give scenarios. And in the scenarios, we are planning for 4 different scenarios. For example, today I'm planning for so 16 sessions, and 16 sessions we are planning, and there are 8 different stations. Suppose we are planning for uro-oncology 1. So that includes an RCC, a bladder, and a upper tract carcinoma. So we are going to have scenarios from all of these topics. Uh, can you please mute yourself? Okay, so we are going to have scenarios from all of these topics. We are going to discuss, it's not that in one day we are just going to discuss RCC and nothing else. In the second day, we are going to discuss bladder. That's not how the FRCS preparation goes. You have to discuss station wise, you have to discuss and integrate all the knowledge together from the onco station, because that's how you have to talk when you are sitting in the station. Okay, so after the 10 minute of discussion, we are going to take the feedbacks, notes, and mnemonics, and all the latest points from the guidelines. We are going to have new guidelines in 2024 very soon, and we are going to get feedbacks. We are going to get updates from those guidelines, because believe me, if you are having your exam, Viva exam second half or in the towards the end of the year, the latest guideline updates are important. So my plan is to engage you like a real exam scenario. And for this, what I'm planning that for at the end of the 40 minutes of discussion, I'm planning for 20 minutes of random discussion where one of you is going to be a candidate for me. And you have to face the real exam 20-minute scenario. I'm going to put 2 scenarios in front of you of 10 minutes each with a bell in between, and this 10 minutes is going to be on either so on the day, suppose we are discussing a pediatric, so 10 minutes on maybe hypospadias. Next minutes you'll be asked on some of the topic, maybe duplex kidney. So anything can be asked, so you should be prepared for this random discussions. This is all that is you have to train your brain with for. So that is what I was talking about, the integrated approach. And believe me, this is really important. The day we are discussing andrology, we have to merge it with the BPH discussion, and because the exam is all about interpreting both the things together. We are going to practice till the day of exam. This is very important, and we should have a lot of knowledge when we are prepare for the section one. We have a lot of knowledge. All that we need to do is learn to express and get the greatest updates from the guidelines. Thank you. So, do you have any questions? Anybody has any question? So if you want to register, you can drop your email, drop me an email at this email ID. I've shared this email ID in the group. We have a few candidates who have registered, and we'll be completing the registration by the end of this week, upcoming week. We will declare the beginning of the course probably by the end of February.
Good evening. Yeah.
Some
Okay. Okay, I will come, sir. Thank you. Bye.
so does anybody has any question? I'm going to wind up now. So thank you for your interest, all those who have registered and chat. Dr. Vakas, could you please mute yourself? So there is a question that for the first part, what is a good resource to start with? So I tell you, you can start preparation with the Oxford textbook of urology. But believe me, the questions have become more clinical, and you have to have a lot of clinical based ideas. So you should know about the latest guidelines and about the different clinical scenarios. They will ask you. They will. So it's not different. The preparation is, I believe, is not different for the part two. The part two is mainly knowledge plus communication. The part one is just barely knowledge. So just stick to the latest guidelines and know how to deal with the clinical situations. And for the facts, you want to know the facts and the percentages, you can rely on the Oxford textbook of urology and the EAU guidelines. So the first part, regarding the guide, so there is no specific guide as such available. So you can solve the MCQs from the Prokar Das Gupta. We have a MCQ summary by him, and you might get some, but believe me, the question patterns have changed, and one-liners, they won't ask you just a single line questions are very rare. So you can use a Prokar Das Gupta MCQ bank to begin with, but again, you have to be very thorough with the concepts and the guidelines.
Beshi, bababa lang ito sa baba.
Any other question? So as I said, the name of the MCQ bank is it's not available. I think it's not available. You can check out the availability, or you can drop me a message in the WhatsApp or the email. I will send you the MCQ PDF. It's a question bank which is available over the internet. I'll send you the question bank. Just drop me a email on this email ID. You need the MCQ bank, just drop me an email. Any other questions? Okay, then we are going to wind up now. Thank you so much for joining. If you have any doubts, any queries, you can. So as I said, the course is going to be for 2 months duration. It's going to start in February, towards the end of February, and the first batch is going to end up in towards the end of April, and the next session is going to be after that. Okay. So if you have any other query, you can drop me an email. Okay, I'll answer your doubts in the email. Thank you so much for joining.
It's 9:1 and